about low back pain in wrestlers today. One of the most common causes for low back pain is lack of mobility at the hips. Very often we see when wrestlers are attempting to extend their hip, whether they're taking a shot or shooting up into a bridge, they will compensate at the lumbar spine and go into extension. That extension posture puts extra compression, extra shearing forces in the lumbar spine, and that's going to, over time, lead to back pain, disc degeneration, and just overall lack of performance. So conventional wisdom for lack of hip mobility would be to stretch the hip or do soft tissue work to correct the soft tissue restrictions or imbalances. But if there is an issue of motor control, where the brain can't differentiate between movement at the hip versus movement at the low back or at the spine, then we need a different way to assess that, because that will not be remedied by the stretching and the soft tissue. So one way to assess for motor control dysfunction in hip extension is to get a big foam roller, place the athlete quadruped with 6 points of contact with the ground. The foam roller at the top is going to connect with the back of his head. In the middle, we're going to be at his T-spine. In the back, we're going to be at his sacrum. We're going to cue the athlete to then maintain dorsiflexion, so keep the ankle flexed, and then just extend the hip by pressing the heel back up towards the ceiling. So first, we're going to show what can go wrong with motor control at the hip and how we assess it. So Johnny first is going to position himself quadruped with the foam roller on his back, and he's going to extend his hip. And then here we're going to see excessive arch in the low back. We're going to see the neck goes up and also failure to stabilize the T-spine. The roller's all over the place now here, so we see he has poor control of his hip. So now Johnny's going to show us the right way to do it. When it's performed correctly, you're going to see the contact is maintained at the back of the head, at the thoracic spine, so the mid-back, and also at the sacrum, the low back. When he extends his hip, you're not going to see an excessive arch in the lower back, and you're not going to see him tip or turn to a direction. So whenever you're ready, Johnny, just kick back. And there's not much change in the back. The roller's not moving around. He maintained his 3 points of contact, so he's good. So the first exercise we like to use to help teach motor control at the hip is the prone hip extension with a lacrosse ball. We take a lacrosse ball, put it right in the back of the knee. He's going to clamp down on that, making sure that he doesn't lose contraction of his posterior leg. What this does is it ensures that the glute max is going to be the prime mover in hip extension rather than the hamstrings or rather than compensation at the back. So we're going to cue the athlete to keep his chin tucked in that double chin position, make sure that the tongue is on the roof of his mouth. He's going to corkscrew his shoulders into place, and then he's going to sync the breathing with his movement. So a big 5-second inhale first. What the breathing is going to do is it's going to cue the abdominal musculature and the obliques so that he's nice and braced in his spine when he goes to do the movement. So then as he exhales, he's going to have a string attached to the heel, pulling him up to the ceiling, and then start that inhale again on the way down. We're going to do 5 reps on each side, and each raising portion should take 5 seconds, so about altogether 25 seconds on each side before your workout. So to progress that last exercise, we're going to move Johnny over to his back, and now we're going to do the cook hip lift. So we're going to bring the same lacrosse ball back, except now we're going to put it in the front of his hip. So Johnny's going to flex his hip up there to make sure he maintains contact with the ball the whole time, no slipping out. The other leg, he's going to have it, the knee flexed in as far as he can go, and then have him up on his heel to make sure that the movement is glute dominant and not recruited from his quads. Johnny's going to take another 5-second inhale just like he did before. And then as he begins his 5-second exhale, he's going to press through this heel, get his hips up as high as he can, maintaining contact with the ball, his abs, and the hip. And then 5-second inhale, bringing it right back down. We're going to do 5 sets or 5 reps of 5 seconds on each side after you've done the extensions, and this will all be part of your dynamic warm-up or movement prep before your workout.
Steady long, steady wrong.